Uh, Good afternoon, respected faculty, and I'm going to present my paper on visual outcomes after refractive laser corneal surgery and phakic IOLs in adult amblyopic eyes. I have no financial disclosures to make in this presentation. To compare, the purpose of this study was to compare visual outcomes in adult amblyopic eyes after laser surgery versus phakic intraocular lens implantation. This was a retrospective study and largest study so far of 680 eyes. And the study period was between February 2013 to July 2019, and the follow-up was 1 year. The patient with refractive amblyopia with a corrected distance visual acuity of 0.6 or worse and no improvement with the pinhole evaluation in an otherwise normal eye who underwent laser refractive surgery or phakic IOL were included in the study. The fellow eye had CTVA of 0.7 or better, and at least 2 difference was noted. The two study groups comprises 524 eyes in laser refractive surgery, 1 eyes in phakic eyes were included. The mean patient age was 24 years, and these were the refractive correction range which were included in the study. Coming to the results, out of 680 eyes at 1 year follow-up, 65.4% of eyes showed 1 line of improvement, whereas 26.1% of eyes showed 2 lines of improvement. And showed 3.6% of patients who have shown no improvement in the study. Regarding the corrected distance visual acuity over the follow-up period, from day 3 to up to 1 year, the visual acuity was well maintained at the same level. We also compared the corrected distance visual acuity between the two groups, LASIK and ICL group, and we found that the visual acuity improved in both the groups, and the improvement was better in the ICL group, although the difference was not statistically significant. We also checked the qualitative analysis of visual vision, and we did the MTF function at 3 mm pupil, and we found that almost all the patients showed good improvement in MTF at all spatial frequencies. There are some literature which have shown that there is improvement in visual acuity in amblyopia patients who are underwent LASIK. In the study by 𝐁𝐸𝐸𝐲, eyes have shown that 91.5% of the patients showed 1 line gain. If we talk about the what makes these patients improvement in visual acuity because they don't improve with the glasses, it could be relative magnification of retinal image both in corneal and posterior chamber plane correction. It could be due to relative reduction in amblyopia. Whereas ICL perform better than LASIK, it may be because the gain is greater when the correction is located closer to the nodal point of the eye. So this could be the reason for this results. And the improvement in contrast sensitivity might be attributed to refractive correction and or the elimination of anisometropia or an anisoconia. So these are the reasons for the results. So in conclusion, adults wishing to have refractive surgery can do so despite having amblyopia, although the proven mechanism of improvement in visual acuity in these adults is still limited.
Thank you, Dr. Bhupesh. We seem to have wandered out of the orbit into the anterior segment, but still an interesting paper. Was your, Dr. Bhupesh is still here, no? Right. Was the type or the amount of refractive error an indication of who would improve more? Were they all myopes that you took, or were there some hypermetropes as well?
So around, we have taken 48 eyes who were hypermetropic.
Okay.
And the results improvement was better in the hypermetropic amblyopic eyes, but not statistically significant, but difference was there in improvement.
And between LASIK and ICL in the hypermetropic eyes?
Definitely ICL performs better than the LASIK in terms of vision, also in terms of contrast sensitivity also.
Okay. And was there astigmatism as well? Did that have any effect?
It was, so most of the patients have 0 to 2.5 diopter, but we couldn't find any significant.
No correlation.
Yeah, no correlation with astigmatism.
And did you have any cutoff for the amount of amblyopia, any vision level that we will not take if it's just 6/60 or something? Was there a cutoff like that? So
patients who have less than 624 vision, we don't take those patients for the surgery because it's not useful for them. If we are operating 24. It is not going
And
to
was
help
there-
them. But
Yeah.
they
Was there
won't
an
develop
age?
binocularity.
Okay. And was there an age group cutoff? What age of the patients you took?
Most of the patients are young, around 20 to
Okay.
24 years, so no significant difference.
Okay. And when you take up these cases, do you tell the patient, because in an amblyopic case, we don't know how much increase in vision would be.
So,
How do you
yeah,
counsel the patients?
So the primary aim is we tell the patient we are doing this, and this is in addition.
Thank you so much,
We don't promise
doctors.
anything that you're going to gain vision,
Okay.
but
All right.
but
I think
after
Now,
moving on to the
we
next.
have 10 minutes
now
for
we
final
confidently
discussion.
say that
Right.
vision
Okay,
will
Dr.
be
Bhupesh
same
will take
or
this up.